And our health correspondent, Nicola, joins us now from London. Nicola, what else have you learned about this study?
It's very interesting, isn't it, the fact that people are going along to this little mobile screening unit in the middle of a very empty business park in Oxford. They're inviting a whole variety of former Covid-19 patients to come and be scanned. So Sampreet, whom we spoke to, as he said, he was asymptomatic. He only found out that he'd had the virus because he was tested following his parents' illness. There was a lady who was there being scanned just before him, and she actually had been quite a lot sicker and was continuing to feel poorly. And apparently somebody earlier in the week had been really ill for about 7 or 8 weeks. And it's this variety of patients they want to look at because they're trying to find out what impact the virus is doing to the organs of the body. We've been reporting on the fact that it's showing neurological changes, so that obviously it's doing something to the brain, and not looking at the brain in this cover scan, I have to say. We also know that it's definitely the virus is having an impact on the heart because of people having irregular heart rhythms and inflammation of the heart. And they're also looking at the pancreas because some people seem to have developed diabetes following the coronavirus. So it's all these different organs that they want to have a look at. And the people who are being scanned at the moment, they're doing it altruistically. They're not going to get the results straight away. They're doing it to further the knowledge about the virus. But if anything does show up, their general practitioners will be informed, their primary care physicians. And then most people are going to be invited along 6 months later to see if there's been any changes to any implications, any impact that's been in their body. And that's probably about next year. They're going to have all these results, which they'll then publish in a medical journal, and they're going to share with the scientific community globally and the World Health Organization.
It must be concerning for these patients to know that they might have long-term effects, but good for them for taking part in this study. Are there any other studies taking place to learn more about COVID-19?
There are actually, Rachel. In fact, I think most countries are doing certain types of follow-up studies because the scientific community is desperate to learn more about this coronavirus. You know, they realise it's not just affecting the lungs, it is affecting other areas. So, for example, in Germany, there's a cohort study that has been running to learn about Alzheimer's. Now, that's being repurposed. So the people who go along regularly to give blood tests are now going to be research is going to be looking to see whether whether they've been infected with COVID-19, and then in the long term, whether this is having any impact on them. This is just one of many studies that are being carried out. Because, as I said, doctors and scientists want to learn more. We've known about the virus for 6 months now, which in the grand scheme of things isn't very long, and there's so much more that they want to learn. I was chatting to a whole bunch of doctors at the weekend. It's the main topic of conversation in the scientific community.
All right, Nicola Hill in London. Nicola, thank you.